Joining us now is Democratic Congressman Brendan Boyle of Pennsylvania. He is the ranking member on the House Budget Committee.
Congressman.
Hello.
Hello.
Good evening.
Good evening. So the Speaker says it's no big deal. The Justice Department, this is all warranted. I mean, the Fed chair's committed some crime, so we have to investigate this. I mean, the reality of it is the weaponization conversation, I think, has always been a little bit lopsided because we're asking the people who are weaponizing the government against the citizen about their weaponization of the government. And so, of course, in their point of view, they're not doing that. But the reality of it is, as the Fed chairman noted in his response, if you will.
Very strong video.
Very strong response. That this administration has gone too far, and it is using the powers that have been given to it under the Constitution and the laws of the country against individuals like himself and citizens as well, as we've seen.
So first, I do appreciate, while Mike Johnson was clearly not one of them, there are a number of Republicans in the House and Senate who, and it's very rare they speak out about an action of the Trump administration, but at least some of them have spoken out because the consequences for our economy would be dire. This is what happens in tin pot dictatorships that suddenly see inflation spike to 50%, 60%, 70% because they so badly devalue their money. I give Jay Powell credit, as well as the other Fed board governors, who have resisted tremendous pressure, completely unprecedented in the over centuries-long history of the Fed. And I hope and pray that will continue because our economy will tank if Trump succeeds in this.
Say more. Say more. Well, because I think to a lot of folks, the Fed feels like a thing that happens in Washington, right? That has no. But,
might as well talk about Mars.
Right.
Yeah.
So how do you actually explain to a constituent why this matters to them? It's
a good question because at first directly people are going to say, look, I care about the fact that premiums are about to double in Pennsylvania and throughout the country. Costs haven't come down. They continue to go up. I don't know much or care about the Fed. Why do I care? The reason why you should care is if you think prices are already too high right now, they will go through the roof if we have a Federal Reserve that says, we don't care about the data. We don't care what inflation says. We are going to artificially lower interest rates just for that short-term sugar high, even though it may cost us for decades to come. Funny enough, even though I said what Trump is doing is unprecedented, and it is, there is a precedent for a Federal Reserve keeping rates too low for too long, and that was Richard Nixon's chair of the Fed. He was a Nixon crony, and he did bend to some political pressure from Nixon. Sure enough, the runaway inflation that we had, the mid-'70s all the way through the early '80s, was a direct result of that irresponsibility by the Fed all the way back in 1970 and 71.
For people at home, the Federal Reserve, the decisions that they make at their board meeting in Washington can make a difference if somebody in your district can get a loan to start a small business.
Mortgage
rates. They can make a difference if someone, where I'm from, in my hometown of North Omaha, Nebraska, a business owner can get the loan to start a small business. And so it really does have ripple effects, which I believe that's why the president is aggressively trying to pull the Fed under his control, because he knows the depth and breadth and the tentacles that they reach all across the country. But he also knows that the people don't know that, and that they could easily glaze over when we talk about this.
Trump always says the quiet part out loud.
Every day,
he has been pretty explicit about this. The fact that we would be paying, let's say we have a great year, interest rates go very low, we all have lower mortgage rates, a lot of people refinance, we would all be very happy with that.
I would like to.
Myself included. But guess what? We'd be paying for it for the next 10, 15, 20 years. And we've seen this time after time in other third world or developing countries. So what I would argue to them is, hey, great short-term fix. It'll be fun for those 6 months or a year. We will then be paying the price for decades to come. And there's no guarantee we would ever get our economy back.
So, Congressman, I'd like to take you someplace I don't think any of us thought we would be in, and that is the land where a Republican says that solving the Obamacare health crisis problem, getting those premiums paid for, that would be America first. I love this headline out of Politico. This GOP senator says reviving Obamacare subsidies will be putting America first. Asked in an interview about his decision to take a leading role in the politically fraught health care negotiations, Senator Bernie Moreno of Ohio deployed one of Trump's best-known slogans, "Putting America first means putting Americans first," he said. "People are being affected, and I want to help the people who need help. That's what we should be doing."
It smells like a midterm election. It smells like the midterms, baby.
Let me check.
Baby.
Do you got a midterm election in your
It's
pocket?
often said where you stand depends on where you sit. And I think there are a lot of my House Republican colleagues. Remember, 17 voted for the clean extension last week, which I was very happy about. But let's just say it was not a coincidence that a lot of those 17 are in very vulnerable seats, and see what's been happening for the past year. Look, we all know the Republicans are completely disingenuous when it comes to this issue. This is the same crowd that was pushing repeal and replace for well over a decade, some 15 years. They held over 63 votes to repeal Obamacare, even in the so-called big, beautiful bill this past summer. Let's not forget, a reason why we're in such a mess right now in healthcare are those healthcare cuts, which include cuts to Obamacare. Now, if some of them want to join our side of the aisle to do the right thing because it's in their political interests, I would welcome their support. But I'm under no illusions as to why they would be doing this.
So it made it through the House. Still waiting to see what the Senate is going to do, just how much pressure Thune feels he's under. But already you have the President of the United States threatening to veto a thing that doesn't yet exist. But OK, he's forecasting that. I want you to help me understand something. January 15th is the cutoff for open enrollment for most states. Some states, California, New York, New Jersey, they've extended it to the end of this month. So you have a lot of young, healthy people who are already opting out of getting coverage because they can't afford it, don't think they need it. You have people who do need it, but feel like they simply can't afford it, given that they've seen the new premiums without these ACA subsidies. So the market, come February 1, it is baked. People either have their insurance or they don't. So even if somehow you manage to pull this out of the Senate, even if Trump doesn't veto it, when do you actually start feeling that and seeing that in premiums?
We already are seeing the premium increases. I'll just give you my state as an example, an average increase of 102%. So almost overnight, we saw premiums go, if you were paying $1,000 a month, you're now paying $2,000 a month. And that's just in the state of Pennsylvania. There are other states that it's even more of an increase in 102%. And we're not talking about a year from now, 2 years from now. We're talking about right now.
But if it passes, how soon do you see a reversal?
Yeah, will there be relief for people?
This is why, if we were going to do this, it needed to have been done yesterday. I will say, though, just to take a step back, while I think we have a real uphill battle when it comes to the Senate, we have to get at least 13 Republican senators to vote with us. We're not near that right now. But we can't give up in this fight. I did an event just this afternoon at Temple University Hospital, which is in my district. 86% of their patients are on Medicaid, Medicare, or Obamacare subsidy. One of the major points a speaker from Temple University Health System made was that it's not just those who are on Obamacare, Medicaid, or Medicare. The rest of us are going to be impacted because those folks are going to go without insurance, and then the ER room becomes the way they get their primary care. He said they're already starting to see that, which means people come, and by the time they come, they're sicker, and it costs them more money.
Just one last quick point on that. People need to understand that, as you said, you need 13 Republican senators.
Right.
How many of those senators are up for re-election this year? So,
That's a challenge.
you know, the politics here requires, if you want to try to save people's health care, then you're going to have to fight for it, and you're going to have to fight hand to hand with a lot of folks around the country to get this done. Because otherwise, to your point, everybody's going to pay. It's not just the poor.
It's everybody.
And people are paying now, and from what I hear, it might be too late. I don't know. We're hopeful.